Selena, it's so good to see you. How are you?
I'm doing great. Really great to see you too, and thank you for having me.
So nice. Thank you so much for coming to talk to me today. So, I think we should start with introductions. So, just tell me a little bit about you.
All right, okay. So I'm Selena. I'm autistic. I'm 39, but I was diagnosed when I was 34, so fairly recent. I did know though, maybe like I say, for about 10 years before that. So it's been a process. Um, I um, I'm the founder and director of Aubergine Cafe, which is uh, a community cafe and national arts organisation run entirely by autistic and neurodivergent people. And so, yeah, we have an incredible team of neurodivergent people. And we also then hire neurodivergent freelancers and workshoppers to deliver workshops for autistic people and neurodivergent people.
I love that. Brilliant.
Yeah, it's like a whole process. It's like a sausage machine, a well-oiled vegan sausage machine.
Great. And we're going to talk about that because it's, like you said, it's so much part of who you are and it's such a brilliant achievement. So, all right. So, I mean, thanks for coming to talk to me. And I've written a few questions down because I wanted to give our conversation a little bit of structure. I find you so fascinating. There's so many areas and little kind of angles that I want to understand about you. One of the
This
pets.
is Malibu.
I
Sorry.
love that. Hi, Malibu. Malibu had something to say.
Yes.
Uh, so, yeah, so the term neurodivergent or neurodiversity is often a term applied to people with autistic traits. And I like to call it a superpower because I genuinely believe that that is what it is. But sometimes it's really hard to deliver kind of happy outcomes in wider society. And I want you to tell me how you see the world and how you made it work for you.
Mm. I think really it's important first of all to kind of like realize that our superpowers, as you call them, and I call them that too, they can be very spiky. So it's really important as a society for us to understand that so that we can create the right environments for autistic people to thrive. And what do I mean by that? It could be that, like, for example, we could be have excellent attention to detail, but we might hyper focus on the wrong detail, so we might just need a bit of guidance. So if we have the right environment which allows us to know which direction we should be looking, we can find what others would really struggle to find. We're real needle in haystack kind of finders. I'm great at numbers. I love numbers, but times and dates elude me. So it's like it's complicated, and we're all a little bit different. And I understand that makes it kind of tricky, but I don't think it's that hard to get it right. Um, Actually, I want to tell you about I don't know if you've heard of the autism dividend.
Yeah, but go on. Do.
Yeah, it's evidence-based research, which is what we want, right? And they talk to like companies like Microsoft and so on, people who get it really right for autistic people because they understand the superpowers, that we can have. And so they've put a lot of money in. Granted, they have it. They put a lot of money into like working out what is the right environment for our autistic people, our autistic staff to thrive. And so what this research does, not just Microsoft, this is all around the UK and sometimes globally, what it told us is that when you create an autism friendly environment in your business, for example, what you do is you end up creating a people friendly environment because people communicate more clearly, they understand one another a bit better, they teamwork better, they feel looked after by their organization, and in return they look after the organization. So it makes business sense, it makes social sense. It's about having a prepared environment. Yeah, that's something that we can learn perhaps from the Montessori school playbook. They say that if you have a prepared environment that creates the right space for people to grow and learn and develop and really excel, and that's what we really want to do at Aubergine Cafe. What we found was that what I found as an individual was that even though I'm really smart and really creative and a great problem solver and people seem to love me, for some reason I didn't fit into the systems in place in most workplaces. It just didn't work for me. So I feel like it wasn't me that was wrong, it was the systems. So I set out to create an environment where we have different systems and we listen to the autistic people who are working with us to help create those systems. And I really hope that we can create like models that others will copy and deploy into the world. I'd really love that.
Yeah, great. And I remember that you and I, well, I reached out to you actually for some help. We wanted to do a Trans Day of Visibility event. And I said to you, hey, how do I make this work for people with a superpower? And you explained exactly what needed to be done. And it was so helpful. Things that I hadn't even thought about.
Do you remember what they were?
Weren't barriers to me. Yeah, namely, you wanted me to record a walkthrough of the space. It was one of the key things that you asked me to do. So there was an event, there was a location, and you said, one thing that would be really helpful is if you could go to the space and record, the front area, the doors, see them open, walk through, show the spaces as a kind of, to set the scene, to kind of, as a sort of a pre-navigation, I guess, of the space, to help people, particularly people who potentially might be anxious or feel a bit lost or need to know the layout in order to feel that they can then, feel a bit more comfortable. And of course, you had one or two people also ready to meet and guide people on the day, which was also, brilliant. So do you remember that? Do you remember that? Yeah.
I do remember that now. Yeah, one of the barriers that we often find is just not knowing what to expect. And it can be like a wall. It's no, I won't do it, for some, especially if we have anxiety as well, which is really common with people who are autistic and neurodivergent. It's too difficult. And so by removing those questions, you're making it so much easier for people to know what to expect and to turn up and go. It's yeah, I really think that's I was just so happy that you listened, that you were thinking of employing that, but
I mean, we recorded it, of course. Then COVID happened and the thing got shut down. However, that then fed into the Welsh Gender Service walkthrough. So we, when we, on our website, when we were building the website to welcome people to the service, we did exactly the same. There was a walkthrough, and it came from that model, that shared wisdom that you shared with us about how best to prepare folk who are coming, and so that people are already well aware of and recognise the environment before they've even set foot in it. So yeah.
And what's beautiful about that is that it doesn't just benefit autistic, neurodivergent people. Everyone could do with that little bit of comfort, that little bit of knowing. Because where does fear come from? Fear comes from not knowing what's going to happen, or not really understanding. And so I think that's really beneficial for a lot of people.
I think that's completely true. So thank you for that piece of wisdom. And may there be many more. We're always learning and developing. So I love that.
And we are too. Yeah.
Yeah, great. So I want to talk about gender, because I remember in a talk you said that gender was for neurotypical people, and I really love that. So I'd love you if you could tell me a bit more about that.
Yeah.
It's a big one.
It is a big one. A lot of us, I'm going to speak generically sometimes. A lot of autistic people feel as though gender is something that kind of eludes them somewhat. And actually, I think some research just came out recently about this. I'll have to hook you up with that. So gender is something that kind of eludes us. In our society, it's like gender is a set of rules, a set of social rules that have been decided for us. Like, this is how you should behave and so on. I don't know if you've ever told an autistic person how they should be or shouldn't be. If they're like, no, I'm not like that. Well, it doesn't often go down very well. And quite often I think it's because a lot of these social rules don't make sense. They don't make sense to us. So how can we tangibly perceive our gender when our experiences don't match up with these societal rules that have been set up? So yeah, I think it's something I love to say is like, it's like, yeah, I think that's a you problem. Like that's not me. I don't have an issue with my gender and who I am as a person. The issue I have is how I fit into the society. Now I am very concerned that, like, if some people were to hear me say this, they'd be like, aha, see, gender is a social construct where you should just be who you are and live with it and not want to change your body and so on. And that's not what I'm saying, because the context is this: we live in the society where these rules exist, right? And we have to learn to live in it. If I may use an analogy, at Aubergine Cafe, we don't really subscribe to a sort of like capitalist hierarchical kind of structure there. However, we have to support our community to learn to live within a capitalist structure, because that's where we live. And if we don't learn that, they don't survive, right? They need to learn how to take care of themselves, how to perhaps get a job, pay their rent, and all of these things, because that's how we survive. We live in a world where we have these social gender norms, and they're different all around the world as well, which is another reason why it doesn't make sense, because why would it be different around the world otherwise? But we have to learn to live here. And if we can help people to become freer versions of themselves, by removing some of these barriers and fears and like really like painful situations that we're in where we don't fit into society, we can't change the society. So just allow us to kind of do things. I really believe in bodily autonomy. I really believe that, you know, we should be able to be informed and choose what we want to do with our bodies. Having piercings all over my face is not my thing, but I really believe in someone else's right to do that, right? And that is how they express their identity and fit in with their peers and so on. You know, I think that it's really important to remember the context of the world that we live in.
Yeah. And we're always asking, are you a boy or are you a girl? And it's something that's pervasive. And you're right, there are social roles, and they are, you know, gender roles, and they are informed by our social construct. But of course, gender identity is something very innate, sense of self, and it's how does that get expressed in the world that puts people into a binary box. And for some people, that just doesn't work at all. So I asked you to, we talked about labels and the way that society likes to label things. People seem to love putting labels on stuff. And one of the questions I posed to you was that if you had to label your gender for the rest of the world, it would be non-binary. But you haven't required any input from the NHS around kind of medical or surgical intervention. And I'd really love to know, and I'd love you to share a little bit of your own transition journey and how you've negotiated discomfort. You've already touched on the fitting in and the not fitting in, and trying to make the world that you live in work for you, because it is the world and you've got to go out there and be in that world. But I'd be really interested to know a little bit more about your own personal journey, if you're willing to share it, because the idea of this film is that people will be watching it and perhaps relating to you, quite strongly in some of the things that you've said.
Honestly, I've not had much of a discussion about gender with the NHS, and there's a couple of reasons for that. One is I don't know what the NHS can offer me as a non-binary person. I just don't know. I don't know. I understand if I wanted to medically transition, I understand what can be offered in that sense, but I don't know what else there is. I don't know what the options are, and as an autistic person, I need to know what the options are before I can visualize and see whether anything would work for me. But another reason is, and this is really important, I once saw my GP, who was a fantastic GP, really great with mental health. He was also a lecturer at the hospital and so on, and absolutely loved talking to him. But once when I approached him, I had to write a letter. I wrote in this letter about my experiences and why I thought perhaps I might be autistic and all of these things. And I wrote in there about, I sort of alluded to gender dysphoria in there, but I wrote about it in a way that made him laugh when he read it. And I think that was the end of that for me. Like that was a funny side point to him. And honestly, I've just had so many other complications that I needed to focus on, like with the autism and ADHD diagnosis, which on the NHS overall and so on has taken so many years, because I can only really deal with one big thing at once. Gender was just at the back of the queue for me.
Yeah.
Mostly because I don't even know what I can sort of like do. I was laughed at when I first approached, a GP about it. So
yeah. And I think some of the experiences that are shared with us are that when people with ASD go to request a referral to a gender service, even if it's just for more information or to find out a little bit more about services, it's almost put down to ASD. So it's in some cases people will say, no, I was basically told that no, you don't have gender dysphoria, it's your autism. So go and let's put you on a waiting list for an autism assessment, because that's what we think's going on. And of course, that's it. These are entwined elements, but they can be separate, because my understanding is that you can't alleviate necessarily some elements of gender discomfort just simply by better understanding your neurodiversity.
Yeah, and I really want to express how that kind of like appears to us. It appears as though you believe that because we might be autistic, we don't know ourselves. I'd really defy anyone watching this right now to look at me and think that this is a person who can't possibly know who they are, right? That it just baffles me that people think that, oh no, it's because their brain's a bit broken. I'm not broken. I'm fine. I've created my whole world and environment where our autistic people thrive. We're fine. We've just been categorized wrongly by too many people. And I think it's really important to just remember that we still know ourselves. We're just trying to navigate a neurotypical world and use the language that you use. And we might just need a little bit more information, because we digest information really well, I think. And there is an added barrier there as well, with mental health, ASD, mental health. Like people might not be able to get an ASD or ADHD diagnosis if they have, say, trauma or BPD or any of those things, and so that delays it again, or makes it so that it can never happen. It means that a transition process for someone who is autistic and has some childhood trauma, I mean, that's common. It means the transition process could be like 10, 15 years,
Right.
Why that inequality? Why should we not have the right to sort of choose our own sort of destiny like everyone else? Sorry, I'm getting a bit.
And I'm interested in the constant negotiation that has to go on, which I think is what you're saying. And I speak to a lot of people who feel that getting an autism diagnosis is really important. And I wonder whether it was important to you and what changed when it happened.
It was really important to me. At first, I thought it was important because it meant that I could legitimately ask for help at work, in my workplace, because I knew I was struggling and so on. I knew why, but whenever I asked for support, they said, well, you don't have a diagnosis. So I got one. But in fact, that actually led to discrimination, because people then did that thing where they said, you're autistic, you don't know yourself. So suddenly I'm a different person and they treat me differently. Send me to occupational health 5 times, and occupational health then say, oh, well, we think actually you're micromanaging. They're like, that's not the answer we want. Let's send you back to occupational health for a new one. So that world stopped working for me. I've forgotten the question. ADHD.
Yeah, so it was about
how important it was the diagnosis
helped you. Yeah.
It meant that I could feel so much more comfortable in who I was. I could like legitimately explain to myself even why I struggled so much in certain situations, but it also then meant that I could put in the right coping mechanisms and I could create my environment that I need to thrive. So it's been an incredible journey, and I've got so many people that I'm sharing it with now, and it's super important.
Yeah, and I guess we should talk about the context of the lockdown, because that's where we're at now. We're just sort of peeking out through the possibility of reopening again. My sister works as supporting neurodiverse kids in the school, and she commented to me the other day how some kids, particularly if they had the right home environment, did so much better at home than they did in the main, because it's a mainstream school, so with some extra help sort of built in around some kids that need it. Mm-hmm. And in the work that I do, I've been communicating with people through the medium of computers. So I've been consulting online. People haven't had to travel to Cardiff to see us. It's a national service, so for some that's a really long way. So I've met people in the context of home, I guess, whatever that means for them. And people share their worlds with me. They talk about their coping mechanisms having always been more online and less in the real world, potentially, but how networks and social capital are built up through gaming or cosplay, or it's as a looking at it as an observer, I see this as escapism, but of course for them it's a whole world where all of the social support gets built in. And this lockdown has really suited some people and helped settle mental health to the point where people realize that and say to me, gosh, I've had a great year. People are sort of complaining, I don't understand why it's been so much better, and realizing how much social anxiety they've actually had trying to navigate the world out there. Yeah. Has that been your experience as well? And have you met people who've shared it?
Yeah, for sure. I've blossomed. I have worked through so many issues. Like my mother passed away in September, and I don't think I would have been able to have coped before. I actually had the time and the space to process. I was allowed to give myself the freedoms to do this, and just it's been an incredible journey as well, being able to sort of like run Aubergine from home and run all of these amazing online programs, and helping to reduce isolation for autistic and neurodivergent adults across Wales.
Yeah,
it's been a really great community builder for us, I think. I'm actually, though, Sophie, I'm really worried. I'm really worried about lockdown ending, not just for myself, but for other people. Now, I know that I cope better than a lot of other people do with kind of changes and doing new things and so on. But I've struggled now. I am so used to being in this place where I've got everything I need around me that when I go out, I went to somebody's garden and I started panicking because I couldn't just go up and inside the house and just, I'm just going to grab myself a blanket. I'm getting a bit cold. I couldn't just go. I couldn't just kind of like take myself away for 10 minutes, or it was all of those tiny little things which were fine before the pandemic, but now they're giving me huge anxiety, and I cope better than a lot of people do. I'm really, really worried about how neurodivergent people are going to cope when things start to go back to normal and people are expected to fit back into the same framework that we found so difficult before.
Yeah, absolutely. And I have to say, I'm the same. I still can't conceptualize how it was and what that looks like and how that feels or how it's even done. And I can imagine the additional burden for people who found it hard before, now finding that really, really difficult thing to negotiate. And I think you raise a really important point about how does that reassimilate? Because when schools went back, my sister reported that some of these kids' behaviours were just off the scale. I mean, so bad.
We need transition.
Suffering so badly back in school. It was the just trying to adapt to that change again was just so difficult, and it was actually quite upsetting for her. You know, reporting back to me how you know how hard it was.
I understand.
For the kids, some of the kids. So, yes, well, I mean, from a service perspective, we're hoping to, well, we will almost certainly keep some online presence so that we're not demanding just face-to-face appointments, that we're going to be as flexible as we can. And it's been a gift. You know, we've always had the need to make sure that people living in North and West Wales particularly have an equal access to this service. And we've only got one solid physical location down in Cardiff. So this has been a blessing for us as a service to make sure that we can actually make it equitable. And I think most of the services that I know of are going to keep an element of remote working, and for whatever reason, you know, but mainly for the comfort of patients rather than anything else, as well as the cost and, you know, making sure that people aren't, you know, spending a fortune travelling and all day travelling and God knows what, staying overnight and everything. So yeah, this has been one really helpful thing. But I'm definitely going to take away some of the suggestions that you made and things that you've highlighted around thinking about better understanding what the service is, what it does, what it's about. And of course, we haven't even talked about the interventions that we're here for, I suppose, things like hormones and surgeries. And of course, there's so much variation in how hormone therapy is even understood, experienced, how the body changes is so variable. And it's made me think, gosh, how do we even prepare people for understanding that when we can't, there's very little to use to predict how the body might feel or how the people might feel psychologically. It's very difficult. And that's even on a good day. People who really need to understand that before they can make decisions. There's a huge uncertainty
there, but it's so difficult. We need more data.
You're right, we do.
The only way we can get more data really is by getting a more streamlined system so that we can pass more people through the system. I think, you know, just a suggestion from, you know, scientist to another.
Great, yeah, thank you.
It's about the data. Sorry, speaking out.
I love it. The other thing that I loved, and I had to look it up, I'm so ashamed of myself, but in the little recorded session that you did for us before one of the conferences that we did, you talked about code switching, and this was in the context of exploring barriers to access health in general. So whether it's going to see a GP or whether it's talking to a mental health professional or, you know, gender professional, whatever. And you talked about code switching and how this was important when you were kind of engaging with health professionals from wide kind of backgrounds. And I genuinely went and Googled it. I was like, what is this thing that Selena talks about? And now I know, and I see this as a bit of an adaptation mechanism, because everybody has an objective. They know what it is that they need. It feels like there's this person that's there that you have to convince that this is what you need to go from A to B. This is what you need to do. Particularly if you've got a degree of certainty. If you're poorly and you don't know what the problem is, and you're going to see a GP and you're sick, then I guess it's a more straightforward transaction. But when people have an idea about what they need to get out of a health professional, be it a GP or a general clinician, this idea of you talked about this idea of code switching, and I'd like you to talk a bit more about that if you can.
Sure. So we'll start by looking at like the origins of code switching. So code switching is well, it's something that Black and brown people tend to do quite naturally in places like the UK and the US and so on. And it's a survival tactic. It's about presenting the side of you that you need to present in order to fit in or survive, to be okay, to be accepted, and those sorts of things. It could be about walking down the street and sort of like changing your demeanor or something so that you feel safer, all sorts of things like that. So for me, it could be that if I go to an event which is predominantly, I don't know, middle class white people, maybe I've been to the opera or something like that, which I do sometimes. I might kind of like, soften my voice a little bit, make my hair not so wild, all of these things to kind of like make myself not look threatening. That makes sense? Wow. I know you look at me and you kind of like think, oh, who's this cheeky chappy? I'm sure. But people's first assumption of me is quite often, is this a threat? When passing me on the street, I have to be careful about how I dress when I'm out, because I kind of look a little bit like a teenage lad. Sometimes police approach me and then they realize that I'm not. It's wild. So code switching is a survival thing, but we're so good at it. We use it in everyday things like seeing the doctors. Of course, this is a survival thing as well. An example, I almost always mention that I studied genetics when I'm talking to a doctor. Isn't that right, Sophie? Because I feel like it kind of like puts me, it removes that thing as, oh, this person is, working class, brown, probably didn't go to university. I don't know. It removes that kind of like thing. It thinks, okay, so this person is a bright person. All right, okay. I want the doctor to like me and to understand me and to know that I've done my research and to know that I go to the right kind of like websites and so on, because I feel like I have to present all these sides of me, because otherwise I'm not enough to take seriously. Does that make sense? Especially because I'm autistic and sometimes talk a lot, and sometimes I go off on one, just a bit like that, and I lose my train of thought and so on. What were you saying? Anyway, so yeah, code switching is really important, and for us, like I say, to survive. And I think that it's good that you're aware of it now. So, is it frozen? Oh,
it's fine.
Yeah. So I think it's really good that you're aware of it now, so that you can perhaps be just a little bit more conscious, maybe about somebody's body language or fears or something, so you might be able to help alleviate some of those.
The more I thought about it, so after that I heard you use that term and I looked it up and I thought, wow, I do it too. So I and I didn't realize that I do it until I found that language and realized that I do, and everyone's doing it. But going back to what you said about perhaps I might be able to think more about the person in the room and making them feel more comfortable. Of course, there's a huge amount of anxiety that gets built up in the run up to meeting me for an appointment, in the gender service context. I mean, I'm a GP as well, less anxiety. Well, maybe a bit, but not so much. But certainly in this context, there's a huge amount that rides on it. And yeah, it's how can you help people feel more comfortable and not have to read a script, you know, or script what they're going to say, and help them to be able to be honest. Because actually honesty is so important. I need that honesty to have that relationship with that person, so that I know that if they're struggling, they can tell me and it's going to be okay. They're not going to get their hormones stopped. They're not going to get told they can't have access to the service, that they feel it's safe to say if there's uncertainty, if they're not sure, if things go in a different direction in the future. And so that first meeting is where all of that trust is established, right? And it sounds exhausting to have to code switch all the time. And I think I went to a brilliant talk from someone called Rubes Walsh, who talks about autism a lot.
Is incredible.
Blew my mind. But one of the things that they were saying, which I thought that's completely true, is the mental energy that is used up in people who are neurodiverse having to just work to get to that same level, and constantly thinking about self-checking. It just sounds like a lot that's going on. And then I thought of that in the context of a first gender appointment, and I just thought, I don't know how people even get to it, you know.
When I had my ADHD kind of appointment meeting, I didn't know whether that was going to be a pre-assessment, whether it's going to be the assessment, who I was kind of going to see. It says you might not see this person. There's no details on it. It's so cold. It's
yeah, it generates a lot of uncertainty before it's even happened.
Yeah. In contrast to that, and this is not a medical thing, but I'm taking part in some research on visual thinkers and the way that they consume news and so on. And I did get an auto reply, but the auto reply was it made me feel as though it doesn't matter that I'm neurodivergent because they will already understand. It just had these things, and it was like, I'm used to working with neurodivergent, you know, it lets us know
right
who the person is. It tells me that when I turn up at the meeting, I'm good to go and talk to this person. They're safe to talk to.
Right.
And
it was simple as that. Yeah.
It's as simple as that. And people like me who are I don't know, who are brown, queer, autistic and all this, we look for indicators to know that something is safe. Just like people might have looked for a rainbow or a pink triangle to know that that was a safe space to go as a gay person, and so on. We look for indicators. You have the opportunity to give an indicator. It doesn't even have to be a personalized letter. It can be, this was an automated response. It did say, I know that permanent auto responses are no fun, but you know, it was friendly, it was approachable, and you were friendly and approachable. So why would this cold letter be the scene setter for who you are? Do you know what I mean?
Yeah, I like that.
I think that can change.
Come to mind. Yeah,
it's one letter that goes out with the appointment letter.
Yeah. Okay.
It's not cost.
You've set me a task.
Returns. Yes. I speak to people about these things who I think will listen and do things, and you have a record of listening and acting upon those things, and I think that the impact can be much bigger than just the conversation between you and me or whoever listens. Simple things, honestly.
Yeah,
we're not hard to.
Great. This is, and I know that when you speak for more than just yourself, which is, why I love talking to you so much, because you will bring, yes, of course, you've shared your own personal experiences and your journey today, which I'm so grateful to you for, but also because of the work that you do with the community, you have these great practical ideas, which everyone should sit up and listen to. So thank you, Selena, so much.
Thank you so much.
Always a delight. Thank you. Cheers.